Most people want to have these abortions at home because it allows them to do it on their timetable, in the safety and comfort of their home, where they can go through it again whenever they want to and however they want to. And so they're actually seeing more people ask to have medications abortions as opposed to having a surgical abortion in a clinical setting.
21 years ago, the FDA approved medication abortion when it gave the green light to mifepristone. Then in 2016, the FDA approved a protocol that combined that medication with another drug, misoprostol. Together, the two drugs are approved for use up to 10 weeks gestation. According to the pro-abortion research organization, the Guttmacher Institute, 40% of all abortions in the U.S. are medication abortions. But there are specific rules to this process.
Medication abortion is literally a 2-pill protocol. The way the rules are written now, you can't get the pills at your pharmacy, over the counter, or in the mail, although the FDA may be changing that.
In May 2021, the Biden administration announced that the FDA would review some of the restrictions on medical abortions after a lawsuit from the ACLU. And restrictions on telemedicine were waived earlier in the pandemic, following a lawsuit from the American College of Obstetricians and Gynecologists.
The Biden administration, I think, is considering changes to the rules governing medication abortion that may make it much easier to get, either to make it such that you don't need to be face-to-face with a physician when taking the medication, even if there has to be some kind of medical monitoring. But that I think that really remains to be seen, although we know that the Food and Drug Administration is considering changes.
From there, states have their own restrictions. 33 states require a licensed physician to write the prescription. 19 states require the doctor to physically be with the person wanting the drugs. This means telemedicine or pills by mail are not an option. And as some states restrict abortions, they are also restricting the availability of medication. This year, some states are also seeking to restrict access to surgical abortion as well as medication abortions.
So if there's just a categorical ban on abortions after a particular gestational stage, if there's a drug that would operate after that gestational stage, I think that would probably be forbidden by the law as well. I mean, that's harder to enforce, and that may be the reason behind the move that Texas made to limit the receipt by mail of those kinds of abortion-inducing drugs.